We all know President Obama has a penchant for a good game of basketball, but last week his famous pickup games became a hazard to his health when he received a blow to the face that required 12 stitches. Now, while the injury was relatively minor, keeping the president healthy while in the White House is a big deal. Joining us with more on this interesting topic is Dr. Chris Magovern, ABC News medical contributor and cardiothoracic surgeon at the Morristown Memorial Hospital. Dr. Magovern, great to see you again. Thanks for being here.
Great to be here, Tanya.
So tell us a little bit about President Obama's injury. It wasn't serious.
It wasn't serious. Was this a common injury? Absolutely.
Right.
Was this a serious injury? Absolutely not.
That's
It's a common sort of injury to sustain when you're playing sports. The lip, you have to remember, is a very vulnerable part of our body. It's soft, it's fleshy, and it's sitting right next to very, very sharp teeth.
Right.
And when you get struck in that area, the lip is going to be on the receiving end of that trauma.
So you get the stitches and that's it.
Well, yes, that's pretty much it. You first need to determine whether or not you need stitches or not. A lot of these injuries can be managed without stitches, but if the cut is big enough, bleeding is one of the problems because it's a very vascular area. So oftentimes you need stitches just to control the bleeding. But his cut was big enough, he got some stitches and he should be fine.
And will there be any cosmetic issue?
We don't think so.
No, okay.
It looks like it's a small enough cut.
Right.
Colleagues of mine that are plastic surgeons warn their patients that when they have this sort of surgery, they need to be careful about stretching their mouth. The stitches will stay in for about 7 to 10 days, but if you stretch your mouth too much, you may have less than ideal cosmetic results. So he may be asked to limit his smiling and limit putting big pieces of food in his mouth.
Which is hard to do when you're a politician, right? Your smile is one of your weapons.
Certainly is.
But so he's by far not the first president to have medical attention.
No, Tanya. In fact, just about every president in our recent history has had some kind of medical attention while he's been in office. I think Dwight Eisenhower takes the cake, though, because he had a heart attack, he had a stroke, and he required surgery for a bowel obstruction all during his tenure in the White House. And of course, we can never forget what happened to JFK, nor the gunshot wound that Reagan sustained in his chest and required surgery. But there are less exciting and less dramatic events that happened in the White House also.
Right.
Jimmy Carter required emergency treatment of a hemorrhoid condition, and George W. Bush passed out while choking on a pretzel. His father passed out in the midst of a flu problem that he was having in Japan. And Bill Clinton tore a quadriceps muscle coming down the stairs. So things are going to happen to presidents while they're in the office.
And of course, presidents don't just get taken to the emergency room like everybody else, correct? They
don't.
They have a different medical procedure, correct? Can you tell
That's
us who it is that takes care of the president?
Well, they don't have to wait in line like you and I do in the middle of the night in an emergency room. And ever since 1789, every president has had their own physician, but it hasn't been until recently, until really 1946, that we've had an organized way of taking care of the president. And this organized method is called the White House Medical Unit. And it is made up of 22 men and women, 6 doctors, nurses, paramedics, physician's assistants, that all have some military experience, usually, who are assigned to take care of the president and his family, the vice president, his family, visiting heads of state, and Tanya, the 1.5 million people that come through the White House every day. They have a small office on the ground floor of the White House, and they're there 24/7.
So if you happen to be a tourist visiting the White House and let's say you faint or something happens, the president's medical unit will attend to you?
Isn't that something?
Interesting.
That's correct.
Interesting.
And in Washington in the middle of the summer, it can get very hot,
Yeah.
and that can be the sort of problem that some of these people have. It's interesting, Tanya, it wasn't always 24/7 the coverage they had. And someone made the bright idea that, well, let me just step back and say, before the Clinton administration, when the president got tucked into bed, everyone went home, and that was it. But someone on the staff said, well, what happens if he develops chest pain in the middle of the night or if he falls down? So that's really how things changed. And after the Clinton administration, we've had someone in there 24/7.
So what happens, though, when the president is on the road? This is frequent. So who's taking care of him on the road?
Great question. When he goes out to go for a run, the doctors will go in a van, in an ambulance behind him. When he goes to play golf, they're in the golf cart behind him. They go wherever he goes. And when he travels, 2 teams of physicians and nurses will go to the president to the destination that he's traveling to, so they can be on call 24 hours. Not only that, they have an advanced team that goes beforehand that prepares medical scenarios, and they determine where they will evacuate the president to. They sniff out the hospitals, determine which hospitals they'll take him. They'll even line up trauma surgeons and critical care specialists so that they're available and they're on call.
This is
fascinating. So it's very well thought out.
Absolutely. Now, I'm assuming, like anything else that has to do with the president's office, there's a certain amount of prestige to whoever gets selected to serve at in the medical unit at the White House. How does that process work?
I don't know. It is a very prestigious job to have. It probably is a lot harder than most of the jobs that we have in medicine. What I can tell you is the best way to not get the job is to ask for the job.
Right.
That's the way you'll definitely.
Does the
not
president
get the job.
have a hand in selecting his
Absolutely.
doctors? He
and
does.
many of the physicians in the past have been the president's former personal physicians. But for the most part, these have been men and women in the military now. But it's a very prestigious job.
So when he is on the road and some of the doctors from the White House medical unit are with him, do they then replenish those positions while he's gone? Because I know that those doctors have to also take care of the vice president's family and, like you said, anyone that comes through the White House.
They have a staff of 6 doctors, Tanya, so that should be enough to travel. And these doctors are usually emergency medical doctors, they're internists, or they're family practice doctors. There's very little role for a heart surgeon in the White House.
Right.
So they're frontline type of guys.
Well, thank you so much, Dr. Magovern, for that fascinating look behind the scenes at the medical care of the president. Thank you so much. And for the latest in the world of health medicine, head to the health page at abcnews.com.